Welcome to another episode of Foad and Friends. I'm with our friend Brian Bassiri-Tehrani, who's our fellow at Metroderm. Today we're going to answer the question that's always asked: am I too old? Am I too young for a facelift? Am I too old is the easy one to answer. You're never too old for a facelift as long as you would benefit from it. Age isn't a factor, it's a general state of health. I've operated on individuals in their late 30s and even early 90s. But I've also told someone in their mid 40s and 50s that their health is such that a surgical facelift is not the best for them. So in terms of being too old, no one is too old as long as they're healthy enough. As far as being too young, that's a different question. 40 years ago when I started in practice, we didn't have the injectables, the energy devices. It was either surgery or nothing else. And if I told someone they were too young, I'd say go and come back in 10 years. Today we have so many options, and I will turn it over to Dr. Bassiri to go through the series of options depending on the changes in the face, the wrinkles, loss of volume, loss of elasticity, and again, age is not in discussion. It's how the face appears and how the face has aged.
Thank you, Dr. Nahai. So starting with simple measures like injectables, we already talked about Botox and fillers and different kinds of toxins that can help prevent the wrinkling from the first place, and then fillers to restore some volume in certain areas of the face that have deflated over time. We also talked about biostimulators in our previous episodes that help recruit collagen and improve the skin quality. The next step above that would be for the skin surface or skin resurfacing procedures, which include chemical peels, dermabrasion, where we basically sand the top layer of the skin, and sometimes we can do a combination of both of those, peel and dermabrasion, what's known as peel abrasion, that will help with the skin surface. Also, lasers like CO2 lasers, which is the deepest penetrating type of laser, can also help with deep wrinkles, and sometimes these can be used in conjunction with a facelift. The patient who needs a facelift has extra skin that won't be addressed with some of these modalities I talked about. And then lastly, leading up to short of a full facelift are the energy devices. For example, FaceTite, where radiofrequency energy is combined with or without liposuction in certain areas of the neck, submental area under the chin, and even in select cases in the jowls that can help contract the skin. But again, those patients do not need a resection or excision of skin for overly sagging or loose skin.
As always, we recommend that you consult with a well-trained, board-certified expert. Now, let's say that you're told that yes, you're a candidate for a facelift. There are facelifts and there are facelifts. We refer to a short scar facelift where the incision is limited to the area in front of the ear and basically stops at the earlobe. Those are best for the individual who has elastic skin, who doesn't need much, if anything, done to the neck. That's called a short scar facelift. Some people call it a mini facelift. The next step would be what we call a full scar facelift, where the incision is continued behind the ear and into the hair, so that not only is the facial skin and facial tissues dealt with, but it also allows to tighten the skin of the neck. And then the next step would be what we call a full face and neck lift, where an incision is made under the chin and the muscle in the neck that's called the platysma is dealt with, and the deeper tissues in the neck are also dealt with. So there's a whole range of relatively simple to very complicated procedures depending on the individual face, which brings us to the topic of the next session, next episode, where we will talk about a bespoke facelift. Bespoke is a very British word which means custom made, like a bespoke coat or a bespoke outfit, or for women, haute couture clothing. So we try to customize the procedure to the patient's face. So your final comments before we close this episode?
I think that there are a lot of options out there and a lot of confusion as to what is right for them. The most important thing is to see a plastic surgeon who can see you and examine you individually and recommend what's best for you.
Thank you.
If you like our episodes, subscribe, like, and share, and we'll see you next time.